Therapy jockey. Today in the studio we have Dr. Srikanth Goggi, a renowned clinical psychologist. Hello, sir.
Hello.
These days we hear people saying they have been referred to a clinical psychologist, they have to go see a clinical psychologist. What exactly is clinical psychology and who is a clinical psychologist?
Well, it's a very interesting question. Many people often ask. Clinical psychology is a branch of psychology, and it is a specialized field within the field of psychology dealing with the mental illness and various psychological disturbances. A clinical psychologist is a person who's working in the field of clinical psychology, especially having 2 years intensive training, supervised training after his post graduation in the mental health setup or psychiatric hospital. And the functions of a clinical psychologist is that to diagnose and assess and treat psychiatric or psychological conditions, which range from addictions to severe behavior problems. And we clinical psychologists are independent mental health professionals duly licensed by a particular government of the country. Like in India, we have a licensing body like Rehabilitation Council of India, and they give the authorization, and even the training is given by the authorized center of the RCI. And this is a 2 year full-time training after your master's in clinical psychology, either MA or MSc. And these 2 years you will have rigorous training in case taking, mental status examination, assessments including conducting psychological tests, reporting, and also there are various treatments. Our treatment include psychotherapies, what we call the psychological therapies like cognitive behavior therapy, individual psychotherapy, group therapy, family therapy, marital therapy, behavior therapy, and EMDR, hypnotherapy, gestalt therapy, like that. These are purely psychological therapies, means under some the framework of some psychological theories. It is more of a talking therapies under the framework to treat some specific condition, clinical condition, usually psychiatric conditions.
So, sir, as you said, it is a psychiatric treatment or it is a therapy given, it is done in a psychiatric setting. So, do you actually give medicines or do you give suggestions to problems or what exactly do you do?
It's one more interesting point that you have raised. Many people do have concerns, especially when we are receiving calls that, sir, our doctor has referred to see you, a clinical psychologist. So they come with an thinking that we do prescribe drugs. A clinical psychologist is basically a trained independent mental health professional who is like any other radiologist or a pathologist. So the main function of a clinical psychologist is to assess the psychiatric or psychological condition and give a final diagnosis after conducting the tests with collaborating the initial intake, like case history, mental status examination, doing 4 or 5 multiple observations. Then we conclude the case that this person has got this psychiatric condition or psychological disorder. Okay, and that is, we are playing a role of a pathologist or a psychopathologist. Then our treatment is doing psychotherapy. Some cases require medicines. So some cases require both medication and psychotherapy. Some cases require only psychotherapy. Some cases require only medication. So if medications are required, we would refer it to a psychiatrist, who is basically another independent mental health professional who has a training in psychiatry. Usually there are medical doctors with MBBS and DPM as a degree, or MD in psychiatry, or DNB in psychiatry, or MRCP, that is Royal College of Psychiatry programs. It's basically the required qualification, and since they are medical doctors, they can prescribe drugs. Clinical psychologists in India, they don't have any legislation or training to write a prescription, whereas in some states of America, they can do a PDF after their PhD in clinical psychology or PsyD. With that PDF, post doctoral fellowship, they are trained to write medications. But in India, we don't prescribe any medicines, we do psychotherapy.
So, sir, what are the other functions of a clinical psychologist? What else how else does it work?
The other functions of a clinical psychologist include an expert giving an expert opinion in the court of law, and he plays a role of a neuropsychologist in assessment of neuropsychological deficits. Most of the neurologists and the neurosurgeons do take the help of the clinical psychologist in the lobar functions or neuropsychological assessments for both surgery, planning a surgery, and also in the neurocognitive trainings. And we also function as a psychodermatologist, where there are psychosomatic conditions. Many psychosomatic conditions are there in the area of dermatology. It is an emerging field. We also function as a psychopathologist in understanding the psychopathology. It is our job to understand what is a psychopathology present in a particular condition. It could be anxiety spectrum disorder or psychosis or any severe pathology conditions like personality disorders. So we understand what is a causative factor and what is the source, and each condition what is the abnormality or the emotional disturbance. So that is also assessing that part is our forte, and conducting research. So a clinical psychologist also plays a role of a researcher and a behavior scientist. Clinical psychologist also plays of a teacher and trainer, giving training extensively into the psychotherapeutic fields like CBT, hypnotherapy, EMDR, gestalt therapy, psychoanalysis, psychodynamic brief therapies, transaction analysis, humanitarian approaches, solution focused approaches, lot of things. So we play the role of a trainer as well as a teacher. And clinical psychology also has seeped into another important area called as development. So development of some training modules apart from research, new advancements are taking place. So a clinical psychologist plays so many roles of a teacher, coach, consultant, researcher, professor, legal expert, psychopathologist, psychotherapist, whatnot.
Thank you so much, sir. You have enlightened us with a lot of information about clinical psychology and the field of clinical psychology. For more such information, please do subscribe, like, and share Psychologist GVA.